Hello, my name is Donato Perez Garcia and I am a medical doctor. I am the third generation of medical doctors who invented my grandfather insulin potentiation therapy, or IPT, back in 1930. Over this period of time, several attempts and research has been done to continue its progress for treating several diseases. I am also representing as the president of the European Academy for IPT, which is an institution for education of medical doctors who practice this procedure. It is very important that interested doctors get a proper certification and attend the basic training course and then continue with their education. If they don't do that, the patient who goes to see an uncertified doctor might face some risk and maybe not receiving the full potential of IPT to treat several of the diseases. The European Academy for IPT is currently the only institution worldwide that can certify medical doctors to practice IPT. I am the president of the Academy and I am also the director of education of the Academy. And I am the only one who trains doctors on insulin potentiation therapy and issue their certificates. This is to prevent other doctors claiming that they do insulin potentiation therapy and end up harming patients. The Academy is always open for new doctors who want to train on insulin potentiation therapy. And we welcome all doctors from different parts of the world in order to make IPT available to patients worldwide. So what is IPT? IPT stands for insulin potentiation therapy. This insulin potentiation therapy is a medical procedure that uses insulin, chemotherapy, and dextrose. The use of insulin in insulin potentiation therapy, it is to improve the entrance of medications inside of the cell. The cancer cell has been growing and has several receptors in its membrane. These receptors do not work without any stimulus, and insulin will stimulate those receptors, allowing the entrance in a smaller dose inside of the cancer cell, thus in turn destroying the cancer cell only and leaving the normal cells intact. With this approach, patients do not experience the side effects of larger doses of chemotherapy, and patients will only experience the destruction or killing of only the malignant cells. With every application, the patient will start to reduce the volume of the tumor as well as the tumor load, because insulin behaves like a modifier of the biological response. It is a natural substance that the body recognizes. When a patient has cancer, the cancer starts to grow because there is a mutation in the cells, might be a genetic component, or triggered by a virus, or triggered by a fungi, or triggered by a bacteria. The patient's body starts to reduce its response to the stimulus. When the cancer begins to grow in a patient's body, it starts to release several chemicals. Those chemicals will go to the white cells, which are the ones taking care of the immune system response. And then they will start to help the cancer grow and protect the cancer, because the signals that the cancer cells at the site where they are growing is that here we have a damage. This damage needs to be repaired. So the stimulus that is being taken by the body is that is an area that it's been damaged. So they start to send all the people that is in the body, which is white cells and other elements, to help heal. And that is the way the cancer self-protects around the cell membrane. The effect of insulin is to open the cell membrane of that area, which might be a type of hacking activity within the cell, thus allowing the entrance of the substances that will be destroying the cancer, which can be different substances in order to protect the patient's normal cells without being affected. When you come to the functional medicine program, you will be treated by the most experienced and certified practitioners. Your delivery of IPT will be given to you based on your personal